So as we discussed earlier, gradient echo bold is kind of the workhorse of fMRI, but there's this known bias towards the cortical surface due to the draining veins, which means that it makes it difficult to interpret layer fMRI when you use it. But some early work, actually done by David, was a sequence called 3D gradient and spin echo, or 3D GRACE, which combines EPI readouts with refocusing pulses to create a 3D spin echo contrast sequence. And this has been used to try and mitigate these biases towards the peel surface. So for example, this plot on the left, the blue is the gradient echo and the red is 3D GRACE. So you can see it doesn't have this bias towards peel surface. This is in V1. This middle plot is from auditory cortex. Again, the black line is gradient echo, which has a surface bias, and the gray line is 3D GRACE, which is much flatter. And on the right here is some work that we did comparing gradient echo bold, VASO, and 3D GRACE bold. And you can see this is in M1, so we're looking for this characteristic double peak that Renzo showed. And the green has the bias towards the cortical surface, whereas the blue and red lines, which is VASO and 3D GRACE, are much flatter, and so you're much better able to see this double peak. So 3D GRACE can mitigate a lot of the problems seen in gradient echo bold. So it's a sequence people might be very interested in using for layer fMRI. So one issue with 3D GRACE is it has a very small field of view because you're trying to basically read out your signal before the T2 decays away. So early work had a very small field of view. You can kind of see this box here, which is just over a little bit of visual cortex. One way to, and if you try and extend your field of view beyond that, you end up with T2 blurring because your signal decays across your echo train. One way to extend the field of view is to use a variable flip angles for your refocusing train. So this is some work done by Valentin Kemper where he did this and was able to extend the field of view, by about double in that axis and without inducing blurring. So another way is to incorporate random sampling into the two phase encode directions. You can further improve your coverage and SNR, again, with reduced blurring. So by adding this kind of random encoding into your sequence, you might be able to extend the field of view of 3D GRACE further without the blurring that we know is a problem. And some early work done by Suhyung was able to do this on the standard 17. You can see that the field of view, for example, in M1 here is extended from regular GRACE with this blue box, with variable flip angle with the red box, and then using this random encoding acceleration, the purple and the green boxes are much larger, getting to the kind of field of view that maybe is much more useful for doing fMRI. And combining this with another random encoding, variable density chi-p, which again kind of does a random encoding across k-space, which again can really extend your field of view without suffering any ill effects. And then basically you can use from the understandable data, you can use a spatial temporal information in the KT space to then do a constrained reconstruction based on coil sensitivity and some temporal pliers based on what you expect your signal to look like. And Suhyung wanted to combine this with the NexGen 7T, which allowed for the readout to be further improved by using the gradients to increase our readout speed. And so we did some testing at various different resolutions, 0.8, 0.64, 0.56, and also down to 0.48. And we wanted to see how far we could push the signal down and still have usable data. And just as a quick test, we used a retinotopic visual localizer. So we were just looking at the difference between target and surround activation. So we'd expect to see this activation retinotopically organized in V1. And so we just want to kind of see whether we could resolve these kind of signals we wanted to see. And we can, so you can see here, so the voxels in red are the ones responding to the target, and the voxels in blue are the ones responding to the surround. So there's this retinotopic localization of our activation, which is maintained even as we push down to the higher resolutions. So we're still able to resolve a meaningful signal using this sequence. And if we compare it just against 3D gradient echo, where you have a much larger field of view and you can resolve all the retinotopic activation, we see this pattern is what you would expect for all three resolutions, even if we push down to 0.56. So we know that we can use this 3D GRACE to resolve this functionally meaningful signal. And the question is, are we getting any advantages of using 3D GRACE for the layer profile? So if we plot the activation across the cortical depth. We can see this blue line is the gradient echo. This is the 0.8 gradient echo we were just using there. And we can see it has much higher signal change, but there's this large bias towards the cortical surface. With GRACE, the signal change is lower because it's spin echo versus gradient echo, so the signal is reduced slightly. But you can see that the profile is much flatter across the cortical surface, meaning that it's much better able to measure this activity across depth without a cortical bias. And if we push down to 0.48 and collected 3 runs and averaged them together, the field of view is much smaller here, so we don't capture all of this red atomic organization. But you can see there's this contrast between the red area and the blue area with a nice fine distinction between them, indicating that we are nicely resolving this activation. And by adding in Nordic, which is a denoising method that has been developed at CMRR, we can further increase this activation and get some nice results. And importantly, when we look across depth, we still see this nice flat profile for the 3D GRACE, which is compared against the bias towards the surface we see with gradient echo. And we also collected some activations in M1, and we're still able to see activation in the finger tapping task, although the activation does reduce as you go to the higher resolutions. And so this is an exciting sequence that could potentially be used for layer fMRI, and we were very happy to collaborate with Suhyung on it, and we're excited to see if there's any further work that can be done with it. Thank you.